We're back, and we were just saying to Larry had something else to say. Larry, what?
Warm and fuzzy
Yes,
kind
indeedy.
of, okay. The way that it stands today, a person turning 18 years old must roll off their parents' plan unless they're a full-time student at an accredited school.
Right.
Well, that is going to change because now mom and dad, you are lucky enough you can keep your child on the plan through their 26th year, whether they're going to school or not.
Whether they're a child or not. I mean, you weren't a child for a long time.
Another rate increase.
Okay, so now, but you know, some of the questions are, okay, so we have this 26-year-old daughter that's married. Let's say she's 24 and married with 2.2 kids. Does her husband get to go on the plan? And then what happens to the grandchildren? Are they on dad's plan? Because maybe he works for the federal government. And so I don't, you know, there's a tail here that has not been clearly defined. But the good news is, mom and dad, you get to keep them on your plan until they're 26 years old, even if they are willing and able to roll off. Now, they can roll off if they're willing, but...
That's just amazing. I mean, 26 years old is still a kid?
See, you
What
said
the
woman.
heck?
That's the new 21.
That's the new 21? Okay, I got you, all right. What do I know? I mean, I just look at this and think, we're America. We're Americans. What in the hell are we letting them do to us? If you haven't joined the Tea Party, my question is, what are you thinking? Why aren't you getting involved? This is making me crazy, Pat.
What about being patriots? Just being a patriot. I mean, looking at this whole Tea Party stuff, I just think you need to be a patriot, be an American, whether you support a Tea Party. Just support somebody who's going to go back to the grassroots that made this country the greatest country in the world.
That's ever been.
But if you look at what they're trying to, first of all, you passed a law, the most significant law in history, without bipartisan support. In fact, not even unanimous support from the one party. And you expect the United States of America to accept it and say, hey, that's great, warm and fuzzy feelings. I mean, the reality is the American people are going to be put in a position where there's no way they can afford this. And they're eliminating all the strategic ways to get insurance. I mean, right now, what's going to happen, and this is in writing, the idea is that the youth of today will subsidize the seniors and the way the rates are going to be spread out. I can tell you right now, in New York State, they've had guaranteed issue. And they have a community rate, a hospital-only plan, where the single rate, 18 to 64, runs around $360 a month. But in New York State, it's two-tier. So if you and I are married, we both have to take that plan. It goes from $365 to about $1,000 a month for a hospital-only plan.
Gosh.
Oh. That's to make it affordable.
Right.
Okay? Nevada's we're never that bad. You know, I granted there's a lot of people out there without insurance, but get a job with benefits, or there's a lot of there was opportunity to acquire insurance.
Why would you?
And we have if you didn't qualify, there was Medicaid. Nothing in the bill identified we're going to fix the problem of insurance fraud with Medicare.
Okay, so
the $90 billion problem.
So let's just say this: if you have a business today, and this is in place, why would you hire employees? Why would you hire employees?
Well, that's a great question, because let me tell you right now, if you're considered a large group and you have 51 or more, you can no longer have a waiting period of more than 90 days. That's going to be prohibited. So that's it.
Insurance the day you walk in the door.
No, 90-day waiting period.
Oh, 90 day. Okay.
So there's no real reason to hire that 51st person. You know, we're going to stay at 49, start a new company or something.
Absolutely.
Right,
so
another subdivision.
Just keep incorporating new corporations and keep...
You have a lot of workers.
Is that the way around this?
Correct me if I'm wrong, Larry. I mean, especially Nevada. I mean, landscapers, right?
Yeah.
Well, landscaping companies have maybe 30 key employees.
Right.
And they have a lot of temp workers.
Right.
Okay, they work 6 months a year.
Right.
By this law being in place, if that puts them over 50, they're going to have to insure those people after 90 days.
So can they form another corporation and then put those people in that corporation?
Now, I'm going to tell you, that's where the IRS code is going to come in, because like ownership would be a problem. Let me tell you right now, this is not going to create jobs.
It's going to kill them.
And it's going to cost employers to say, you know what? I'm comfortable making
Yeah.
$400,000 a year, and I don't need to go
249,000.
249.
That's right, because the 250 is no good because
That's
they
right.
nail you for
They're
that as
going to
well.
get you for being that
Right.
successful.
But I mean, Larry, you and I have been in this business combined 40 years, 20 years apiece. At least I'm in at least 20, and I know you're because you're a lot younger than I am. But the reality is, I mean, where do you see this going? I mean, when you look at this type of thing, how is it going to help people get insurance?
Okay, if we were to take these 2,400 pages of healthcare reform and bundle it up, what it really is 2,400 pages of tax law bundled into, there's a little bit of healthcare reform in there, but it's really a tax bill. It is a full-on tax bill, not a healthcare bill. I wanted to go back just for a moment about the Medicaid. There were a lot of people eligible for Medicaid, but they didn't know that they were eligible. They didn't know how to get into the system. I'm here to tell you that had they turned it over to brokers like Pat and myself, we would have found a way for these people to get into the system. They didn't pay us to do it. Nobody likes to work for free. So granted, we would help people that we would stumble across, but we didn't aggressively seek out people, and nor did they want us to show them how to get into the system, because if everybody that was eligible got into the system, this whole Medicare thing would have, Medicaid would have sunk a long time ago. So the big question about so much of these reforms is, what is going to be the delivery system? Be the free market enterprise, as Pat and I are
Fat
in.
chance.
Right. I mean, if they cut us out, now we are called navigators, and we're here to help people navigate through this law. I just want to tell the folks that your best defense against all of these federal acronyms coming out of the White House, coming out of Carson City, is a well-informed broker. Be sure and ask, is your broker a member of the National Association of Health Underwriters?
Because that will make a difference. They'll have the answers for them.
Yes.
I mean,
Or know where to get them.
know where
Right.
to get them. Yeah. I mean, this is just, and you know, if they make it really complex, makes it a little bit harder for you to really understand. You finally come down to where I just don't want to know. Okay, they're taking the money, you know. I mean, yeah, we can't afford anything anymore, but I don't want to fight this. No, that's the wrong attitude. Stand up and do not let them do this to us. Do not allow this to happen. Call everyone in the government and tell them no, no, no. We'll be right back.